Hello, everybody. I'm your host, Dr. Vav Lee, and you're watching Open, the only live interactive program that brings the Bronx and New York City straight to your TV set. Stay connected to us through social media at BronxNet TV. Leading things off, the period for open enrollment for health insurance is approaching, and joining us with all the details and information, we have Renee Whiskey, and Patrizia Bernard from the Bronx Community Health Network. We welcome you guys to the show.
Good morning. Thank you.
Now, the enrollment is pretty big now. People are enrolling in bigger numbers than ever before, or compatible to what it used to be.
That's correct.
Talk about it.
So first, at Bronx Community Health Network, we're a not-for-profit organization as well as a federally funded health center. And we have over 21-year history of providing affordable quality access to medical services as well as community health programs. So through our robust community health program, we are able to go out into the community to find people who need access to health care, whether it's through insurance or through connecting them to primary care doctors, and then really set them up with ongoing medical care.
And this is the Affordable Care Act we're talking about.
Correct.
That's correct.
Yes. Obamacare.
Obamacare, the Affordable Care Act. So since the marketplace opened in fall 2013, we have been able to enroll over 15,000 people through our health centers and our community health workers. So all of our community health workers are certified application counselors, and what basically means is that they're trained and able to enroll people into the marketplace and the health insurance.
So we have these open enrollment dates, which started when and ends when?
Go ahead.
Okay, so open enrollment started November 1st and will end January 31st.
January 31st.
January 31st. So this year there's been a lot of confusion, especially with the new administration. A lot of people have been thinking about whether the Affordable Care Act is going to be repealed or not, so they don't know if they should still enroll for it or not.
Yeah.
And the second thing is in a lot of states, 42 states exactly, the enrollment period has been reduced by half of the time that it actually used to last for.
Yeah.
So it used to last November 1st to January 31st, but in most states this year, it'll go from November 1st to December 15th.
So there's a lot of restrictions on it now because of the new administration. So what's going on?
So that's correct. The new administration has decided that they're going to cut the time frame down in order to kind of capture less people. The good thing about New York State is that we've made provisions for our own marketplace. New York State really manages and controls their own insurance marketplace. And what we've been able to do is, because we have that control, we've extended the deadline to January 31st, keeping the full 90-day period. What we know is that young people tend to enroll later. We want you to enroll earlier, but having 90 days is better than having 45.
So for the people who are confused and think that, from hearing that Obamacare is going to be eliminated or repealed, what do you tell them?
The marketplace is still up and running, and in New York State, you have the luxury of enrolling up until January 31st. The earlier you enroll, the better, but you have up until January 31st.
And who qualifies?
Basically, everybody in New York qualifies. It all depends on income and family size, but there's a plan for everybody. So really, depending on those two factors, we're able to determine what plan is best for you. And even if you have no income, there are some free plans that are also available out there for people.
So there's a big effort out there to spread the word, to reassure people that the Affordable Care Act is still on and going strong.
That's correct.
Correct. Yeah. The current administration has actually slashed the outreach budget, so they're not advertising about it as much.
Gotcha.
And so that's why, as an organization, we took the initiative to produce some PSAs, and we're really trying to play them on social media or wherever it is that we can to really inform people about the enrollment period and to let them know that they should still come and enroll.
So, but people are still enrolling in big numbers.
That's correct, because there's a need there. People need access to quality care, and the way to do that is through having insurance coverage.
Do you think it will be repealed? And if it does, what do you think will happen?
It's hard to say. I think that in New York State, we've always had provisions for people who are in need, and regardless of whether the Affordable Care Act stays or doesn't stay, I think New York State will make some provisions for people who cannot afford, but we hope that it does stay around.
Do you have tips for people who want to enroll?
Sure. Get to a community-based organization right away to help you enroll. You can contact us at 929-220-8181. Get to someone who can help you. It's a difficult application process, but there's free help to help you enroll.
And if they have a problem, what can they do?
Again, I think that the best way is to get in touch with people that are trained to enroll people into the marketplace. People can do it on their own online, but it's always you can always get the help you need if you talk to a certified application counselor that can guide you through the process.
Renee and Patrizia, I'm going to give you this camera. Say hello to my little friend.
Hello.
And just ask people, tell people what you want them to know.
Well, what we want you to know is that enrollment is still on. Go out and enroll. And tomorrow is Giving Tuesday. Our enrollment, as well as our other community health programs, really are supported by giving. So on Giving Tuesday, check us out on all social media platforms at BCHN Health to find out how you can help support our community programs.
That's it.
You want to add to it?
No, I think.
All right, give them a big round of applause, everybody. Thank you so much.
Thank you.
Renee Whiskey, BCHN Community Health Programs Developer, and Patrizia Bernard, BCHN Community Health Worker Supervisor.
Correct.
Thank you so much.
Thank
We'll take
you.
a break. We'll be right back.